Hi, I'm Chris Pruitt. I'm a cataract and glaucoma specialist with the eye surgeons. The purpose of this video is to talk about what cataracts are, what cataract surgery involves, and what risks go along with cataract surgery, and to talk about the various types of intraocular lenses that we can use at the time of cataract surgery. This is a normal appearing eye that does not have a cataract. The black spot in the middle of the eye, the pupil, appears nice and clear. The lens is clear inside the eye, located behind the pupil and behind the iris. It allows light to be focused very well on the retina. Then the retina takes those images and sends them down the optic nerve to the brain. An eye with a cataract does not have a clear pupil. The lens, instead of being clear, is partially opacified and light scatters as it passes through it. This is what it looks like in real life. Here you can see that this person has a very bad cataract and probably cannot see very well at all because the lens is opacified. This is what a normal healthy lens looks like. The lens is clear and light can pass through it readily. There are various symptoms that go along with cataracts. Typically, you have blurry vision all of the time that's not fixed with glasses. You can also get glare and halos. This is worse typically during low lighting conditions when the pupil is very big. So times like night driving. Also, if you have direct sunlight in your eyes, it can be very bad as well. This is a photograph of someone having halos around lights and starbursts and glare while driving at night. This is an image of someone having a lot of glare and starbursts with direct sunlight. They can't see their kids or their grandkids playing. And here, this is someone having glare from oncoming headlights. These are all symptoms of people that have cataracts. So again, ideally we would be able to take a lens that had a cataract and heal it and turn it back into a clear lens, but that technology doesn't exist yet. Instead, what we do is we remove the cataract and we put in its place an artificial lens that helps focus light. So after removing the cataract, this patient can now see much better because they have a lens that is clear and focuses light well on the retina. There are risks that go along with surgery to remove a cataract. Roughly 1 in 10,000 people can have a very major infection that can threaten the eye, can threaten vision. It's very, very serious. That's again about 1 in 10,000. About 1% of people may need an additional eye surgery to get a piece of the cataract out that got away from the surgeon, or a surgery on a different part of the eye like the retina. About 3% of people may need additional medications after surgery for inflammation or for eye pressure being a problem. And about 5% of people have some degree of dissatisfaction after the surgery. That could be from glare or halos, problems with the new lens, needing glasses after surgery, or from dry eyes or irritation after the surgery. A side note here, cataract surgery does make dry eye worse. It doesn't happen with everyone, but it's important to take your dry eye control very seriously before surgery. And we have some other videos on how to best take care of dry eye. Those will be linked in the description. You can still have some visual problems after cataract surgery. If you have a spread of light, we call that glare. If you see a ring of light, we call that a halo. If you see lines through the light, we call that a starburst. So this is an image of someone who has halos, starburst, and glare. You can still have a degree of this after cataract surgery. It's typically much less than before the operation, though. This is an image of someone who has something called a dysphotopsia. In their peripheral vision, the edge of the lens can cause some funny visual phenomena. Here, this person has a darkening due to the edge of the lens in their vision. It can happen, but it's very rare. I just think it's good to know about these things before you go to surgery. So there are multiple types of lenses that we can put inside the eye at the time of surgery. So the base model is called a monofocal lens. So these come in standard or in toric that correct astigmatism. We'll talk about that in a little bit. There are also extended depth of focus lenses and multifocal lenses. And these are the so-called premium lenses. These are the monofocal lenses. That means that they focus light one distance away from you. The lens on the left is the standard lens. It's shaped about like a soccer ball. What that means is that no matter what orientation it's in, it still has about the same amount of optical power. Some people have something called astigmatism. Astigmatism is when the cornea, the front part of the eye, is shaped a little bit more like a rugby ball than a soccer ball. To correct that, we can put a toric lens in the eye. And a toric lens is special because the orientation of the lens is very important. Because if we change the orientation, the power of the lens changes as well. So these are very good lenses for patients that have astigmatism. Now, there are also lenses that have multiple focuses in them. They allow you to see far away, and some of them allow you to see intermediate range, and some of them allow you to see up close, generally with minimal dependence on glasses. So here, this lens has a distance focus in the top and a gradient of intermediate and near focus in this portion of the lens in the bottom. Similarly here, this lens has a distance focus in the middle and a gradient of intermediate and near focus in the edges. So these lenses typically allow you to see up close, intermediate, or distance with less dependence on reading glasses or bifocals. So we have many options for what type of lens to put inside the eye at the time of cataract surgery. The way we decide what lens to put into the eye is we ask you what type of glasses you want to use after surgery. If you use a monofocal lens, like a toric or a standard lens, you can either have both eyes focused for distance, both eyes focused for near, or you can have something called monovision. If you have both eyes focused for distance, that means you will need reading glasses for intermediate and near work. If you have both eyes focused for near, for instance, if you have a history of being nearsighted and you really like that, then you can continue to be nearsighted afterwards and put glasses on to see far away. And then lastly, there's monovision. This is where one eye is distance focused and one eye is near focused. If you have had this before, I think that it's a very reasonable thing to do for you. If you have not tried monovision and you want to do this surgically, you must have a trial of monovision with your optometrist or with us prior to undergoing this surgery. And I'll explain why now. This is an image of someone who has a distance focused lens in their eye. So here you can see the trees very clearly. You can see the individual chain links in the fence. You can see the clouds. Everything's nice. However, here you can't read the book very well because this is near focused. This is an eye that is near focused. Here, the book is very clear. You can see that this is David Patton who wrote this book. Unfortunately, now you can't see the trees as well. You can't see the chain link fence as well. You can't see the clouds as well. The problem is that most people can't mentally separate one eye from the other. So now the near eye can kind of see the book, but it's a little bit blurry because the distance eye is fighting with the near eye. In here, you can kind of see the tree and you can kind of see the clouds and the chain link fence, but the near eye is fighting with the distance eye. So that can be very frustrating. And that's why I demand that people have a trial of monovision before choosing this as their surgical option. So if monovision isn't for you, we also have extended depth of focus lenses and multifocal lenses. Extended depth of focus lenses give you relatively good distance and intermediate vision, but you would still likely need some reading glasses or bifocals for near vision. Multifocal lenses give you relatively good distance, intermediate, and near vision with minimal dependence on glasses, but there's no guarantee that you will be completely glasses free. Most of our patients still need some degree of glasses use, perhaps 10% of the time. So, with extended depth of focus lenses and multifocal lenses, you tend to get good distance vision in each eye, but you may still need glasses for your very best vision. You tend to get better intermediate and near vision with the glasses off, but again, you could need some glasses from time to time to see intermediate or near. Interestingly, there was a paper that I will link in the description that talked about how patients with multifocal lenses tended to be a little bit more stable on their feet than patients that had a standard lens or a toric lens. The thinking is that when you can see up closer to yourself, you're able to walk a little bit better than if you don't have that intermediate or near focus. Now, there is a trade-off to these lenses. The purpose of these lenses is to try to decrease your dependence on glasses for intermediate and near work. Because of that, sometimes you can have some very mild glare or halos, and again, a very mild contrast decrease. So, which one is right for you? Well, if you have a history of monovision, the correct answer is monovision. That's worked in you before, and that's a very cost effective way to get you out of glasses. If monovision does not work for you and you're very particular about image quality, for instance, you're an engineer or you are a painter or you do a lot of microscopic work, um, perhaps it would be best for you to use monofocal and then know that you're still going to be in glasses afterwards. If you want minimal dependence on glasses and you're willing to take the risk, the small risk that you may be dissatisfied due to either glare, halos, or decreased contrast sensitivity, an extended depth of focus or a multifocal would be a very good option for you. There are no guarantees on your glasses independence. There will still probably be times that you need to use glasses. We unfortunately cannot offer you perfection. We can't turn back the clock to when you were 20 years old. I wish we could. I wish I could for myself as well. In the worst case scenario, if you are dissatisfied, we can exchange the lens inside the eye. That's a second surgery. It's something that we try to avoid because there are risks that go along with that. But that is a surgery that we perform should you require that. We can still work with you even if you're not happy with the lens the first go round. So, in summary, we talked about what cataracts are. We talked about what cataract surgery entails and the risks that go along with it. And we talked about the various types of intraocular lenses that we can use at the time of cataract surgery. Thank you for letting us take care of you. Thank you for learning with us. And please feel free to reach out to our office with any questions.